Fitness assessment. The purpose of this section is to provide the fitness professional with valuable techniques to build a complete fitness assessment for a client and to provide the fitness professional with information about how the human body should move and how kinetic chain imbalances alter movement. Following this presentation, the participant will be able to explain the components and function of an integrated fitness assessment, ask appropriate general and medical questions in order to gather subjective information from clients, understand the importance of posture and how it relates to movement observation, and perform a systematic assessment to obtain objective information about clients. A fitness assessment is a systematic problem-solving method that provides the health and fitness professional with a basis for making educated decisions about exercise and acute variable selection. Assessments provide an ongoing gathering of information, allowing the health and fitness professional to modify and progress a client through an integrated training program. It is important that the health and fitness professional understand that a fitness assessment is not designed to diagnose any condition, but rather to observe each client's individual structural and functional status. Furthermore, the fitness assessment presented by NASM is not intended to replace a medical examination. If a client exhibits extreme difficulty or pain with any observation or exercise, the health and fitness professional should refer the client to his or her physician or qualified healthcare provider to identify any underlying cause. Health and fitness professionals should not diagnose medical conditions, but rather obtain exercise or health guidelines from a physician, physical therapist, or registered dietitian. Health and fitness professionals should not prescribe treatment, but instead refer clients to a qualified medical practitioner for medical exercise prescription. Health and fitness professionals should not prescribe diets or recommend specific supplements unless qualified. Instead, refer clients to a qualified dietitian or nutritionist for specific diet plans. Health and fitness professionals should not provide treatment of any kind for injury or disease aside from basic first aid. Rather, refer clients to a qualified medical practitioner for treatment of injury or disease. And finally, health and fitness professionals should not provide counseling services, but rather act as a coach for their clients and refer clients to a qualified counselor or therapist if need be. Subjective information. When conducting a fitness assessment, it is essential to utilize a variety of observation methods in order to obtain a balanced overview of a client, such as subjective information, including general and medical history, and objective information, including physiological assessments, body composition, cardiorespiratory assessments, static and dynamic postural assessment, and performance assessments. Subjective information is gathered from a prospective client to give the health and fitness professional feedback regarding personal history such as occupation, lifestyle, and medical background. One of the easiest forms of gathering this information is through a questionnaire. The Physical Activity Readiness Questionnaire, or PAR-Q, is a questionnaire that has been designed to help qualify a person for low to moderate to high activity levels. Furthermore, it aids in identifying people for whom certain activities may not be appropriate or who may need further medical attention, such as clients with coronary heart disease. Some common questions included on a PAR-Q would include: has your doctor ever said that you have a heart condition and that you should only perform physical activity recommended by a doctor? Do you feel pain in your chest when you perform physical activity? In the past month, have you had chest pain when you were not performing any physical activity? Do you lose your balance because of dizziness, or do you ever lose consciousness? Do you have a bone or joint problem that could be made worse by a change in your physical activity? Is your doctor currently prescribing any medication for your blood pressure or for a heart condition? Do you know of any other reason why you should not engage in physical activity? If the individual answers yes to one or more of the above questions, they should consult their physician before engaging in physical activity. Asking some very basic questions concerning a client's history and/or personal background can also provide a wealth of information. Two important areas to start with are occupation and lifestyle. Knowing a client's occupation can provide the health and fitness professional with insight into what his or her movement capacity is and what kinds of movement patterns are performed throughout the day. Examples of typical questions include: does your occupation require extended periods of sitting? Does your occupation require extended periods of repetitive movements? Does your occupation require you to wear shoes with a heel, for example, dress shoes? Is your occupation mentally stressful? Does it cause anxiety? Questions pertaining to a client's lifestyle will reflect what a client does in his or her free time. This is generally known as their recreation and/or hobbies. Finding out a client's medical history is absolutely crucial. Most importantly, it provides the health and fitness professional with information about any life-threatening chronic diseases such as coronary heart disease, high blood pressure, and diabetes. Furthermore, it provides information about the structure and function of the client. Some important areas to cover include past injuries, surgeries, chronic conditions, and medications. Physiological assessments. Objective information is gathered to provide the health and fitness professional with forms of measurable data. This information can be used to compare beginning numbers to those measured weeks, months, or years later, denoting improvements in the client, as well as the effectiveness of the training program. Categories of objective information include physiological assessments, body composition assessments, cardiorespiratory assessments, movement assessments or posture, and performance assessments. Physiological assessments provide the health and fitness professional with valuable information regarding the status of the client's health. By assessing and reassessing a client's resting heart rate and blood pressure, health and fitness professionals gather valuable information in designing a client's conditioning program. In addition, the following tests can be used as motivational tools assisting in client retention. The resting heart rate can be taken on the inside of the wrist, known as the radial pulse. To find the radial pulse, lightly place 2 fingers along the arm in line and just above the thumb. Once the pulse is identified, count the pulses for 30 seconds and multiply by 2. For example, if you count 40 beats in 30 seconds, multiply 40 by 2, which equals 80. So the individual's resting heart rate is roughly 80 beats per minute. On average, the resting heart rate for a male is 70 beats per minute and 75 beats per minute for a female. The health and fitness professional can also calculate the training heart rate zone in which a client should perform cardiorespiratory exercise. Create heart rate zones by first determining the client's estimated maximum heart rate by subtracting the client's age from the number 220. Second, multiply the estimated maximum heart rate by the appropriate intensity, 65 to 90%, in which the client should work in while performing cardiorespiratory exercise. Zone 1 consists of 65 to 75% of the maximum heart rate. Zone 2 consists of 80 to 85%, and Zone 3 consists of 86 to 90% of the maximum heart rate. For example, for a 45-year-old client, subtract 45 from 220, which equals 175. This represents the estimated maximum heart rate for the individuals. If you want to find their Zone 1 training heart rate zone, multiply 175 by 0.65, or 65%, and 0.75, or 75%. So for this individual, their Zone 1 training heart rate zone is between 114 and 132 beats per minute. Blood pressure measurements consist of systolic and diastolic readings. The systolic reading, the top number, reflects the pressure produced by the heart as it pumps blood to the body. Normal systolic pressure ranges from 120 to 130 millimeters of mercury. The diastolic blood pressure, the lower number, signifies the minimum pressure within the arteries through a full cardiac cycle. Normal diastolic pressure ranges from 80 to 85 millimeters of mercury. Blood pressure is measured using a sphygmomanometer, which consists of an inflatable cuff, a pressure meter and a bulb with a valve, and a stethoscope. To record blood pressure, instruct the client to assume a comfortable seated position and place the appropriate size cuff on the client just above the elbow. Next, rest the arm on a supported chair or support the arm using your own arm and place the stethoscope over the brachial artery using a minimal amount of pressure. Continue by rapidly inflating the cuff to 20 to 30 millimeters of mercury above the point when the pulse can no longer be felt at the wrist or heard. Next, release the pressure at a rate of about 2 millimeters of mercury per second, listening for a pulse. To determine the systolic pressure, listen for the first observation of the pulse. Diastolic pressure is determined when the pulse fades away. It is important for the health and fitness professional to go through formal hands-on training in taking blood pressure prior to assessing blood pressure on health club members. Body composition assessment. One of the most important pieces of information that can be obtained by a health and fitness professional is the client's starting body fat percentage, as body fat reduction is often the primary goal of many clients. The National Academy of Sports Medicine utilizes the Dernan formula, or sometimes known as the Dernan-Womersley formula, to calculate a client's percentage of body fat. This formula was chosen for its simple, 4-site upper body measurement process. The Dernan formula's 4 sites of skin fold measurement are as follows: biceps, triceps, subscapular, and iliac crest. To measure the bicep, a vertical fold is taken on the front of the arm over the biceps muscle, halfway between the shoulder and the elbow. To measure the tricep, take a vertical fold on the back of the upper arm, with the arm relaxed and held freely at the side. This skin fold should also be taken halfway between the shoulder and the elbow. To measure the subscapular, take a 45-degree angle fold of 1 to 2 centimeters below the inferior angle of the scapula. To measure the iliac crest, take a 45-degree angle fold just above the iliac crest and medial to the axillary line. When taking these measurements, all should be taken on the right side of the body for standardization purposes. After the 4 sites have been measured, add the totals of the 4 sites. This should be done in millimeters. Then find the appropriate gender and age categories for the body composition on the Dernan-Womersley body fat percentage calculation table. For example, if a 39-year-old male has a skin fold sum of 45, then his body fat percentage would be roughly 20%. Circumference measurements can also be another source of feedback used with clients who have the goal of altering body composition. They are designed to assess girth changes in the body. The most important factor to consider when taking circumference measurements is consistency. Remember when taking measurements to make sure the tape measure is taut and level around the area that is being measured and the same side of the body is measured each time. To measure the neck, the tape should be aligned directly across the Adam's apple. To measure the chest, position the tape across the nipple line or upper chest for women. To measure the waist, measure at the narrowest point of the waist, below the rib cage and just above the top of the hip bones. If there is no apparent narrowing of the waist, measure at the navel. To measure the hips, your client needs to stand with their feet together. Position the tape across the widest portion of their buttocks. Measuring the thigh consists of positioning the tape 10 inches above the top of the patella for standardization. When measuring the calf, the tape is positioned at the maximal circumference between the ankle and the knee. Lastly, the arm. At the maximal circumference of the biceps, measure with arm extended, palm facing forward. Cardiorespiratory assessments. Cardiorespiratory assessments provide the health and fitness professional with valuable information regarding cardiorespiratory efficiency and overall condition. They can also provide health and fitness professionals with a starting point for which zone their client should begin cardiorespiratory exercise specific to that person's physical condition and goals. 2 common forms of assessing cardiorespiratory efficiency are the 3-minute step test and the Rockport walk test. The step test is designed to estimate a cardiovascular starting point. Step 1. Determine the client's maximum heart rate by subtracting the client's age from the number 220. Then, take the maximum heart rate and multiply it by the following figures to determine the heart rate ranges for each zone. Step 2. Perform a 3-minute step test by having a client do 24 steps per minute on an 18-inch step. The step may need to be lowered depending on the client's physical capabilities, for a total of 3 minutes, roughly 72 steps total. Have the client rest for 1 minute. Then, measure the client's pulse for 30 seconds and record the number as the recovery pulse. Use the formula in your text to determine the client's cardiorespiratory efficiency value. For example, if an individual's recovery pulse was 70 beats per minute, then multiply 70 times 5.6, which equals 392. Then take the duration of the exercise, 180 seconds, and multiply it by 100, which equals 18,000. Then divide 18,000 by 392, which equals 46. Step 3. Locate the final number, 46, in one of the following categories. In this particular example, the individual scored a 46, which is considered fair. Step 4. Determine the appropriate starting program using the appropriate category. Clients with a poor score will start in Zone 1. Clients with a fair score will also start in Zone 1. Clients with an average score can start in Zone 2. Clients with a good score will also start in Zone 2. clients with a very good score can begin in Zone 3. Based upon their score, our example client would start in Zone 1, or 65 to 75 of maximum heart rate. The Rockport walk test is also designed to estimate a cardiovascular starting point. Like the step test, first determine the client's maximum heart rate by subtracting the client's age from the number 220. Then take the maximum heart rate and multiply it by the following figures to determine the heart rate ranges for each zone. Step 2. Record the client's weight. Next, have the client walk 1 mile as fast as he or she can control on a treadmill. Record the time it takes the client to complete the walk. Immediately record the client's heart rate in beats per minute at the 1 mile mark. Use the formula in the textbook to determine the VO2 score. For example, your client was a 45-year-old 200-pound male. He had a heart rate of 165 beats per minute after completing the test, and it took him 10 minutes to complete. Plug the appropriate numbers in the formula provided in your text, which will provide you with one's VO2 score. In this case, the individual scored a 33 on the test. Refer to the tables in your textbook to determine the fitness level he's in. In this example, the client would fall into the fair category. The category will then determine the appropriate training zone to start your client. In this example, because the individual scored in the fair category, they would start in Zone 1 training, 65 to 75% of maximal heart rate. Posture and movement assessments. Every movement needs a base from which to generate and accept force. This is better known as posture. Posture is the alignment and function of all components of the kinetic chain at any given moment. Posture is often viewed as being static or without movement. However, everyday posture is constantly changing to meet the demands placed upon the kinetic chain. The main purpose of proper posture is to maintain enough structural efficiency to overcome constant forces placed upon the body. Dynamic postural observations, or looking at movements, are often the quickest way to gain an overall impression of a client's functional status. Because posture is a dynamic quality, these observations show postural distortion and potential overactive and underactive muscles in its naturally dynamic setting. Movement observations should relate to basic functions such as squatting, pushing, pulling, and balancing, in addition to providing crucial information about muscle and joint interplay. The observation process should search for any imbalances in anatomy, physiology, or biomechanics that may decrease a client's results and possibly lead to injury. These assessments can be incorporated as a first workout for your client. There are various assessment techniques that will be described and can be incorporated as a first workout for your client. Each assessment described also contains key kinetic chain checkpoints to observe. These checkpoints include the feet, knees, lumbopelvic hip complex, shoulders, and head. The first movement assessment to review is the overhead squat assessment. The overhead squat assessment is designed to assess dynamic flexibility on both sides of the body, as well as integrated total body strength. To start, position your client with feet shoulder-width apart and pointed straight ahead. Have the client raise his or her arms overhead with elbows fully extended. The upper arm should bisect the ears. Next, instruct the client to squat to roughly the height of a chair. Have the client repeat the movement 5 repetitions in each position, anterior and lateral. From the anterior view, pay close attention to your client's feet and knees. Specifically look to see if the client's feet turn out and if their knees move inward. These movement impairments may be indicative of muscle imbalances in their lower extremities. Make sure to review the table in your textbook to view probable overactive and underactive muscles that may be contributing to these compensations. The probable overactive muscles will need to be stretched, while the probable underactive muscles may need to be strengthened. Specific corrective strategies to improve these compensations will be provided in Chapter 6, Flexibility Training. From the lateral view, pay close attention to the lumbopelvic hip complex and shoulders. Specifically, look for an arching of the low back or an excessive forward lean of the torso. At the shoulder, look for arms falling forward. Each of these compensations will indicate potential muscle imbalances at the lumbopelvic hip and shoulder complexes. As with the previous compensations, make sure to review the table in your textbook to view probable overactive and underactive muscles that may be contributing to these compensations. This will again provide you some guidance as to which muscles will need to be stretched and which muscles will need to be strengthened to improve movement quality. Specific corrective strategies will be provided in Chapter 6, Flexibility Training. The second movement assessment is the single leg squat assessment. This assessment is designed to assess ankle proprioception or balance, core strength, and hip joint stability. Your client should place their hands on the waist and focus on an object straight ahead. The feet should be pointed straight ahead, and the foot, ankle, and knee and the lumbopelvic hip complex should be in a neutral position. Have the client squat down on the one leg, performing up to 5 repetitions before switching sides. When observing your client perform the single leg squat, look to see if the knee moves inward. This may indicate potential muscle imbalances in the core and lower extremity. As with the overhead squat, make sure to review the table in your textbook to view probable overactive and underactive muscles that may be contributing to this compensation. This will again provide you some guidance as to which muscles will need to be stretched and which muscles will need to be strengthened to improve movement quality. Specific corrective strategies will be provided in Chapter 6, Flexibility Training. The next assessment would be a pushing assessment. When performing the pushing assessment, instruct the client to sit with the abdomen drawn in, feet shoulder-width apart, and toes pointing forward. Instruct your client to press handles forward and return slowly. Perform up to 20 repetitions. During the pushing assessment, look for any compensations, including the low back arching, elevating shoulders, and/or a protruding head. These compensations indicate potential muscle imbalances at the lumbopelvic hip complex and upper extremities. The next assessment is a pulling assessment. The setup is the same as the pushing assessment, sitting upright while keeping the feet shoulder-width apart and feet pointing straight ahead. Instruct your client to pull the handles toward their body and return slowly. Perform up to 20 repetitions using a 2:02 speed per repetition. Use the checklist below to record movement faults. The compensations you're looking for during the pulling assessment are the same compensations you looked for in the pushing assessment. Compensations would include the low back arching, elevated shoulders, and/or a protruding head. As with the pushing assessment, this would indicate potential muscle imbalances of the lumbopelvic hip complex and the upper extremities. As with the previous compensations, make sure to review the table in your textbook to view probable overactive and underactive muscles that may be contributing to these compensations. This will again provide you some guidance as to which muscles will need to be stretched and which muscles will need to be strengthened to improve movement quality. Specific corrective strategies will be provided in Chapter 6, Flexibility Training. Performance assessments. Performance assessments can be utilized for clients trying to improve athletic performance. These assessments will measure upper extremity stability, lower extremity agility, and overall strength. Basic performance assessments include the Davies test, Shark skill test, bench press strength assessment, and squat assessment. The Davies test is designed to assess upper extremity agility and stabilization. This assessment may not be suitable for individuals who lack shoulder stability. To start, begin by placing 2 pieces of tape on the floor 36 inches apart. Position the client in a push-up position with one hand on each piece of tape. Instruct the client to quickly move his or her right hand to touch the left hand. Perform alternating touching on each side for 15 seconds. Repeat for 3 trials. Record the number of lines touched by both hands. Reassess in the future to measure improvement of number of touches. The Shark skill test is designed to assess lower extremity agility and neuromuscular control. It should be viewed as a progression from the single leg squat, and as such, may not be suitable for all individuals. To start, position the client in the center box of a box grid with hands on hips and standing on one leg. Next, instruct the client to hop to each box in a designated pattern, always returning to the center box. Perform twice with each foot, 4 times total. Penalize 1/10 of a second for each of the following faults. The non-hopping leg touches the ground. Hands come off hips. The foot goes into the wrong square, or the foot does not return to center square. The bench press strength assessment is designed to assess upper extremity strength and estimate the 1 repetition maximum for training intensity purposes. This is considered an advanced assessment for strength-specific goals and, as such, may not be suitable for many clients. To start, position the client on a bench laying on his or her back. The feet should be pointed straight ahead. The low back should be in a neutral position. Next, instruct the client to perform 3 to 5 repetitions with perfect form. Chart the amount of weight used for accomplished repetitions and refer to Appendix F of the textbook entitled Percent of 1 Rep Maximum Conversion for comparison charts to estimate the 1 rep maximum. The squat assessment is designed to assess lower extremity strength and estimate the 1 repetition squat maximum for training intensity purposes. Like the bench press assessment, this is considered an advanced assessment for strength-specific goals and as such may not be suitable for many clients. To start, position the client with their feet pointed straight ahead and knees in line with the toes. The low back should be in a neutral position. Instruct the client to perform 3 to 5 repetitions with perfect form. Chart the amount of weight used for accomplished repetitions and refer to Appendix F of the textbook entitled Percent of 1 Rep Maximum Conversion for comparison charts to estimate the 1 rep maximum. Summary. A health and fitness professional's primary responsibility is to safely and effectively guide clients to successful attainment of their goals. To do so requires a comprehensive understanding of clients' personal and professional backgrounds, as well as their physical capabilities and desires. The fitness assessment is a comprehensive tool to systematically gather information about clients and utilize the information appropriately. To design a safe and individualized program, one must go through a thorough assessment to determine the client's wants and needs. Remember that the program you design is only as good as your assessment. Keep in mind that the fitness assessment is not designed to diagnose any condition nor replace a medical examination. Health and fitness professionals should refer clients to qualified healthcare providers whenever necessary. Some key components to include in one's assessment include subjective assessments, which provides information about a client's personal history, including occupation, lifestyle, and medical background, and objective assessments, such as body composition, cardiorespiratory assessments, movement observation, and performance tests. These assessments provide measurable data that tracks changes in a client. These assessments not only serve as important tools to individualize a program, they also act as good motivation tools during reassessments, potentially keeping the client